learning principle is professionalism is as important to student growth as clinical competence. Now picture the brain lifting weights. Anyone who's lifting weights, if they are lifting a fairly significant weight, knows how important it is to have the weight equally balanced. This is similar to the clinical competence side and the professionalism side of training students. They are both elements that are critically important and need to be equally weighted in our design of the training experience. When you're talking about clinical competence, we provide this training to students by giving them practice at what it is we want them to develop their skill and knowledge in. And that's going to be very unique to the rotation. It depends on the nature of the rotation and the opportunities that are available at the practice site. But the key here is that the learning comes from actual involvement, from practicing what it is we want them to learn through action. It's very different to training students to develop their professionalism, to develop professional behavior, professional demeanor. We help students develop a sense of professionalism, not by giving them things to do or things to practice, but by immersing them in a culture that exhibits the professional behavior that we want them to develop. Now, this is where it really helps to be consistent across rotation sites within a program. For example, if as a preceptor, it's very important to me that students develop a commitment to academic honesty. If they write a paper, they submit something, a newsletter article, for example, they submit that to me, I should be able to accept the fact that they're honest and that they've actually done the work. And we know that I have had cases in which some students have plagiarized material. It's so easy now on the internet to cut and paste information. So in my rotations, I tell the students up front from the very beginning, if you commit blatant plagiarism, fraudulent plagiarism of a written assignment, you will fail the rotation. That may seem very harsh, but it communicates to the students how important that is as a professional behavior for a profession like pharmacy that is so dependent on honesty and integrity. Now, if a student in the same program were to go to another rotation with a different preceptor, and that preceptor doesn't really care about whether they plagiarize, and they were to plagiarize, and the preceptor says, hey, if you plagiarize, don't worry, I'll tell you not to do it again, but I'm not going to fail you on the rotation, or I'm not going to assign any specific consequences to you. That sends mixed messages to the student. They're not being immersed in a consistent culture. So one of the things that's very important is from rotation to rotation, in terms of executing the professional development of a student, is to see to it that there's as much consistency as possible across rotations and across training sites. Taking this a step further, I developed a design of a taxonomy of professionalism based on 3 dimensions. Published this back in 2009. This is based largely on my observations as a pharmacy director, evaluating the performance of hundreds of pharmacists who I worked with over the years. And what I observed was that at the most basic level, the pharmacists needed to have a fundamental competence, a professional capability, a knowledge of pharmacy that was sufficient for them to perform competently as a pharmacist. And that is critically important. But I think many of you who've worked in pharmacy would agree with me, that's not enough. Truly exceptional pharmacists, the kind of pharmacists that you want to work with, have more than competence to offer. And competence alone is not going to make someone an extraordinary pharmacist. What I observed was that the second level, the higher level of professionalism that would enable a pharmacist to take competence to a higher level is connection, being able to connect with people, to communicate effectively with people. I call these people skills. It involves interpersonal compatibility. The pharmacist who can get along with people, who works well with coworkers, who relates well to patients and to nurses and physicians, is far more effective than the pharmacist who simply has good competence but lacks people skills. And the highest level, the highest dimension of professionalism is character, personal reliability, ethical skills, being trustworthy, the type of person that people can rely on, who demonstrates honesty and integrity, which kind of relates to the plagiarism example that I provided earlier. So what we're trying to develop in our students is this three-step approach that we not only provide them with the competence in pharmacy that they need, but we afford them an opportunity to develop their people skills, strengthen those skills, and also emphasize the importance of character in their professional behaviors. Our last experiential learning principle is that competence requires action. Now, it's pretty clear, if we go back to our basketball analogy, it's pretty clear that if you can't shoot the ball into the basket, that's incompetence when it comes to a basketball player. What I would argue is that the basketball player who's capable of shooting the ball through the basket, but when they have an open shot, chooses not to take it, is just as incompetent as the basketball player who can't shoot. In other words, if you have the capacity, if you have the ability to shoot the ball through the basket, but you don't, you still don't score any points and your team is still going to lose. So pharmacy is a lot more than just having the ability. It also involves the motivation and the inspiration to become involved in patient care and utilize your knowledge in practical ways to help patients and to provide services through the pharmacy department. Wayne Gretzky, who wasn't a basketball player, he was a hockey player, but one of the greatest of all time, has a great quote about taking the shot. He said, "You miss 100% of the shots you never take." How true that is. You can't score if you don't shoot the ball, and you can't provide good patient care if you don't actively get involved in patient care. So let's review what we've covered in this first video. The experiential learning principles, we've covered 5. First, good precepting starts with defining good learning outcomes. Those learning outcomes function as the target. They define what we want students to achieve during the rotation. And everything needs to be focused on those learning outcomes. Second is learning as a product of thinking, that we have to engage students in critical thinking, the kind of thinking that causes them to analyze information, evaluate information, form their own conclusions. It's that deep level processing, those higher levels of cognition, that will enable them to develop the deep learning that they can use in the future in a variety of ways and that they will retain long term into the future. The third principle is that students must progress from cognitive knowledge to performance ability. It's not just about getting them to learn what we want them to learn, but getting them to do what we want them to do. Not just to be able to do it, but to actually do it when the opportunity arises. This gets to the next principle, and that is professionalism is as important to student growth as clinical competence. Students need to develop their communication skills, and they need to be immersed in a culture that manifests the type of character that we want them to develop as a true health professional. And lastly, competence requires action. If you don't actively get involved as a health professional, you're not going to be able to provide much assistance to your patient population. We also covered 4 guaranteed preceptor techniques. The first one is to master the fundamentals. Identify that 20% that's most critical for 80% of the outcome, and make sure that students have ample opportunity to thoroughly develop their skills and develop their knowledge in relation to those fundamental aspects of learning. Second principle, or the second technique, is ask, don't tell. In other words, don't lecture to students on an advanced practice experience rotation, but ask them questions, draw it out from them, get them to think critically and make decisions and answer questions. Tell me why is the third technique, and this involves asking them probing questions, continually asking them why. Why do you think that? How does this work? Explain the mechanism to me. What if something changed? What would you do then? Constantly get them to dig deeper into their thought processing. And then lastly, the importance of automatic recall. That there are some facts that students should be able to recall effortlessly. And if they have to struggle recording those facts, it's going to make it much more difficult for them in the future. The remaining sessions that we've got coming up, Session 2, about assessment, evaluating student performance. Session 3, on designing a structured, well-organized learning experience. Session 4, on bringing out the best in every student. And our last session will be on the traits of great preceptors and the qualities of great rotations. This concludes Session 1. I hope you will continue on and participate in Session 2.